The question is, will staffing that facility be a challenge? A recent survey by LinkedIn reports that 61% of American workers are thinking about leaving their jobs in 2023, and that includes the healthcare industry, where the burnout factor remains high. I recently spoke with a Harvard professor about the reasons behind that. Dr. Gazelle, thank you so much for being with us today. I've got just a handful of questions to ask you, if that's okay.
Oh, it's my pleasure.
How is the Great Resignation impacting the healthcare industry?
Oh, it's affecting it dramatically. And we're seeing levels of people leaving their jobs, physicians, nurses, technicians, therapists, even the janitors that clean our hospital rooms are leaving healthcare in droves. And it's really creating a level of disruption that we haven't seen previously in healthcare, and I think is going to impact all of us in terms of the health of ourselves and our loved ones.
Dr. Gazelle, why do you think it's happening?
Well, that's a complicated question, isn't it? You know, what we saw with the pandemic is people really stepping back, people questioning their sense of purpose, their sense of commitment, their sense of loyalty to jobs like healthcare. And really, I think, second guessing whether the path they had been on is the right one. We're also seeing so many levels of shortages partially induced by the pandemic. For example, the nursing shortage, which is profoundly affecting the country. And again, if nurses can get paid more by moving to another city as a traveler, or by even moving to a different hospital in their same locale, you know, in a society like ours, that's a big incentive.
Thank you for that, ma'am. How is it disrupting healthcare, do you think?
Well, if you think about a hospital floor or an ICU or an emergency room where each individual, each healthcare professional, the nurse, the advanced practice nurse, the physician assistant, the doctor, is required to provide the kind of care that any of us would need when we fall ill. And you think about those numbers dwindling. So, for example, a nursing ratio in an ICU might have been one nurse for two patients. That might have been the standard, or one nurse for one patient for critically ill individuals. And because of the shortage, nurses are stretched to one nurse taking care of three patients or one nurse taking care of four patients. So what that means in terms of the intensive attention that a critically ill patient needs, their needs are not going to be met. So it's really kind of frightening, not just for patients, for any of us and our loved ones should we fall ill, but also kind of the sense of duty that that unfortunate nurse has when they can't fully do their job.
What is imposter syndrome, and how does it relate to those leaving the field?
Well, the imposter syndrome is when we start believing that we're not the real deal, that others are smarter than us, that others are more accomplished, more talented, more attractive, better at their job. And it can even be better as a parent, for example, or as a community or church member. And it's a very erosive mental state where we start comparing ourselves to others, kind of comparing our insides to their shiny outsides. And it can leave us feeling like we're some kind of fraud. And what I've seen in the hundreds of physicians that I've done career coaching with over the last decade is that the prevalence of the imposter syndrome in these otherwise highly accomplished individuals is actually quite high.
Are hospitals and other healthcare facilities trying to offer the mental health support these professionals need?
Well, the good news is that there is tremendous attention now to the wellness of the physician and nurse workforce, and that was not the case even 5 or 10 years ago. So because of the high levels of burnout throughout everyone in healthcare, there's a lot more focus on well-being.
Dr. Gail Gazelle, thank you so much for spending a few minutes with us. It was enlightening for a lot of different reasons. Thank you.
Thank you so much.
Closer to home, several programs have been launched to help encourage more Oklahomans to go into the healthcare field to fill the workforce gap.